discussing signs and symptoms. There aren't many outward symptoms. A patient may not know that they have osteoporosis for quite some time. It just tends to sneak up on them. You don't feel your bone mass leaving, but over time your bones may become weaker and weaker, and you may not know it until you take a fall or something occurs, some traumatic injury, and you have increased fracture risks. So fractures occur more readily, especially comminuted fractures where because of the low porosity, these bones tend to shatter much more readily than stronger bones, which hold together much more likely. And then that's about it for signs and symptoms. But having the diagnosis, the most common way to diagnose this is to have bone densitometry done in the form of a DEXA scan. So a DEXA scan is very, very commonly done. It may be done as a preventive measure based on the physician's recommendation, or it may be due to early warning signs of osteopenia, meaning bone loss. So let me put this down here for a second. As they may do a health, or they obviously will do a health history and physical, but then they'll order a bone densitometry scan or a DEXA scan. So what this does is it sends the patient in for x-rays, and it measures the density of bone at some of the areas right around the femur, the head of the femur, around the lumbar, and then they also will do the wrist. They measure it in T-scores, and this T-score they put against the normal values, or if you have a low enough T-score, it may be what's called osteopenia, or low levels of bone mineral density. Or if it's large enough, they may diagnose with osteoporosis.